First, let me say what a great pleasure it is for us to have such a diverse group of participants, largely drawn from the public and voluntary sectors, but also from a variety of other sectors. I think we are all in for a great treat in this event, which is the launch of the Human Learning Services ebook from the Center for Public Impact. I am Naresh Singh. I am Professor and Vice Dean of the School of Government and Public Policy at the O.P. Jindal Global University in India, where I also direct the Center for Complexity Economics, Applied Spirituality, and Public Policy. I'm a former public servant, having served as a Director General in the Federal Government of Canada, as a Director and Principal Advisor at the United Nations Development Program in New York, and as head of a Caribbean regional intergovernmental body. But for full transparency, let me say that at the moment, I'm speaking to you and I'm joining this webinar from Ottawa, Canada. I am particularly excited about the launch of this ebook on human learning systems, as I think it heralds the possibility of a major shift, what one might call a paradigm shift in how public service is delivered, in how people help people meet their needs. Not only what they need, but how their needs are best met. One group of people who help others is government employees. And for them to start seeing themselves as such might be a big step forward and a big challenge as well, especially if they are in the public service management system, which many of us call new public management. I have been in that system, and the shift required is fundamental. It will be challenging, but from what I can see and from all appearances, it will be very rewarding as well. It is in this context that we find the main and very inspiring message of this ebook, that we can create public service for the real world by doing public management differently. Before I outline the program and introduce our speakers, I have a few housekeeping announcements. The meeting is on the record, so please do share your insights on social media. Use the hashtag Human Learning Systems as one word. The webinar is going to have live captions. It's being recorded. We'll share a recording in the email we send out to our attendees after the webinar. There will be an opportunity to ask our speakers questions using the Q&A function during the Q&A session. We will be curating questions and will also address common themes raised in the questions that people submitted when they registered. There will be what is being called an after party or a Zoom after party for about 30 minutes, which will be a space after this formal webinar. It will be a space for an informal reflection on what you have heard from the speakers, the case study contributors, and attendees in smaller breakout groups. Amy will post the link in the chat, which you will be able to join from about 4:30 p.m. Dr. Toby Lowe will moderate that session, and I will be handing over to him at the end of this formal webinar session. So for now, let me turn to our program and our speakers. Our program this afternoon, or as I said, whatever time of day you might be in, the time zone, our program consists of a presentation by Dr. Toby Lowe, followed by 3 case study presentations of roughly 7 minutes each. And then a panel discussion among the speakers, Toby, as well as the case study presenters. Then we will have a Q&A for about 15 minutes, fielding questions from the audience, as I've mentioned. I will then conclude this session with a call to action. Altogether, all of this will just take about an hour and a half, and then we will have the half-hour after-party conversation with Toby that I just mentioned. And a separate Zoom link will be shared in the chat box for those of you wishing to join this extra half hour. Before let me just mention that first we will have the presentation by Toby, Dr. Toby Lowe, who I will introduce. This will be followed by case study practitioners, first Sam Kammerling, then Katie Owen, and Oli-Pekka Enonen. And their CVs will be posted in the chat, which you can see. I will just do brief introductions to each speaker. So we will start with Dr. Lowe. Let me first introduce him. Toby has spent 15 years working across public and voluntary sectors in the UK, working in both policy and delivery roles. He's on secondment to the Centre for Public Impact from the Newcastle Business School, where he has been working alongside public and voluntary sector organizations to develop an alternative paradigm for public management, one which enables public service to work more effectively in complex, dynamic environments. Toby, over to you. You have 20 minutes.
Thank you very much, Naresh. So hopefully people can see my screen now. I am so pleased to be able to share with you the findings of our report, Human Learning Systems, Public Service for the Real World. And it's amazing to be speaking with so many of you today. Now, can I make that work? Yes. Key message from our presentation. You have a choice about how you do public management. And if the way that it's been done right now feels wrong, you can change it. So I'm going to be outlining some of the what the alternative looks like for this in terms of a human learning systems approach. Important to say at the start that it's me. You're getting a presentation from me, but actually this is work that's been produced by an amazing collaboration of organizations. So you can see that the 6 organizations there on screen have been working together for the last 12 months to bring this report together. And then we've had additional contributions, case studies, and all sorts of other things from more organizations than we can possibly fit logos on a screen. So you're getting me, but I'm effectively standing in for a huge range and number of people involved in this work. So let's start with a definition. What do we mean by public service? And we mean public service is purposeful work that supports human freedom and flourishing. And straight away, you can see from that what we mean, public service isn't a sector. So this isn't about public sector, voluntary sector, private sector. All those who do purposeful work that supports human freedom and flourishing, we are including in our definition of public service. And the question that we would ask of everyone who does that is, do you have a feeling that there's something wrong with the way that public service supports human freedom and flourishing? And if you do have that sense of wrongness, we think that's because it is wrong. And the important thing to say is that sense of wrongness isn't coming from you. It's not you. You don't feel wrong because you're a bad worker or bad manager or bad leader. Our explanation for this is we have a public management problem. So what do we mean by that? Well, public management is simply the name of the discipline, the task by which public service is planned and organized. So all the forms of public, all the forms of work that support human freedom and flourishing require some form of planning and organization, even at micro scale. And we think it is the way that public management is done that can explain at least a significant amount of that feeling of wrongness. Because there is a current dominant paradigm for public management. It's called New Public Management. It was created in the 1980s as a specific ideology. It's often known as the 3 M's: markets, managers, and metrics. I don't propose to go into the detail of that now, but you will probably see elements of that you recognize in the framework for your own work. And the problem with new public management is that it just doesn't work in complex environments. So here's just a fraction of the research evidence around that. So Christoph Hood is one of the most preeminent public management scholars in the world, completed a review of 3 decades of evidence around the new public management reforms. What did he find? New public management creates higher costs and more complaints. If you dig into some of the practice that underpins new public management, like target-based performance management systems, systematic review of all the studies into target-based performance management in 2018 found that 80% of the studies find evidence of gaming, that's deliberate manipulation of data, and nearly 3/4 find evidence of deliberate lying. Right? This research evidence says this stuff does not work. The way that we kind of interpret that evidence is that new public management creates a simplified fantasy world in which the abstractions of data points substitute for the complex reality of life. And so people end up using performance data that's routinely gamed, as we've seen from that evidence. They write plans that they know won't be delivered. They create budgets that they know don't reflect the reality of the work. And worst of all, it treats the people we serve as data points, not as full human beings. That's the evidence. A couple of stories to illustrate this question. So first one comes from Gateshead Council, who are one of the people who've been doing kind of HLS stuff the longest. And they wanted to try something different with the people who've been experiencing problems with paying their council tax. So they tried to build kind of deeper relationships with those people and say, what is it that's going on in your lives? How can we understand you? And then whatever it is that's going on, how can we help? And so one of the people they reached out to doing that immediately put the phone down on them, phoned the council switchboard and said, I've just had a prank call, someone pretending to be from the council. I knew it couldn't be someone from the council because they offered to help. Let's take a moment to consider that the public have got so used to the idea that public services do not help them, that anyone offering help cannot be from a public service worker. Second story, I was a witness to this story, which it was a conversation between an NHS commissioning manager and an NHS finance director, provider. Commissioning manager was describing the work that their team was doing to try and create alternative costing structures and pricing for NHS activity in order to enable outcomes to be produced. And they were saying how difficult their team was finding that work. And the finance director turned around and said, it's all right, don't worry about it. Whatever you come up with, it'll be fine. Because I employ a whole team of people to produce like just kind of good looking data for you. We just make this cost information up, right? That's the game. Oh yeah, I know that's the game. This is why new public management produces higher costs and more complaints, because we've got extremely smart, pretty well paid teams of people making up fantasy data for each other. So, in some respects, the most important message from our work, you have a choice. If you're experiencing the failures of new public management, you can choose to do public management differently. And that choice, we think, starts by embracing the complexity of the real world. Because as kind of public managers, we've been trapped in a box of our own making, this simplified fantasy world where if we do A, then B happens. But if we open the door, we find the complex reality of the world. And it's by opening that door to the complex reality of the world that we can begin to create public service for the real world. Brings us on nicely to the work we've been doing. So we've been learning from a whole number of case studies of organizations who've been trying to do something different. So we've got 48 case studies of HLS in practice, 29 which were created especially for this report, from small scale local voluntary sector organizations right through to national government. So we know what an alternative approach to public management looks like. Because we've seen these people doing it. So human learning systems is rooted in the reality of the practice of people who've been trying to do something different with public management. That said, our knowledge around this is massively incomplete, because there's still so much to learn about what this alternative looks like in all sorts of different contexts. And it's also important to say that this report, and my presentation to you today is brand new. So you are the first people in the world to hear this presentation. And so a bunch of the ideas and a bunch of the language might not be kind of adequately expressive, might not connect for you yet. And so we want to be in conversation with you in order to help us get better at this kind of stuff, because it won't be right now. So all that was introduction. Let's dig into this. Human. The human element speaks to the kind of fundamental beliefs of human learning systems. So we think that the purpose of public service is to promote human freedom and flourishing. And secondly, to understand a human being is to see them in the complex web of relationships that is their lives. So we're talking about a view of humans that is radically interdependent. And these beliefs have consequences. So for human freedom and flourishing means that only we have the right to determine outcomes in our lives. Obviously, there's a caveat around that about kind of capacity issues for some people and for children, and that's true. But the general principle stands. Only we have the right to determine outcomes in our lives, whether that's individual outcomes or collective outcomes on a community basis. And secondly, the outcomes are created by all the actors and factors in my life. So all the people and organizations, all the causal drivers, all interacting together, that is what creates an outcome. And this is a really important starting point for us, because this is the reality of how outcomes are made. So if we want public service to help create human flourishing, which is just another word for outcomes, then we need to understand the reality of how an outcome is created. And we need to start our public management processes from the reality of how an outcome is created. So let's dig into this idea that an outcome is the product of the interaction of all the actors and factors in a life. We can visualize this for the outcome of well-being, for example, by viewing a person's life as a complex system that is made up of actors and factors. So one way to visualize this is as a solar system, where the person themselves is the sun at the center, and then the other actors involved, their family and friends, the neighborhood organizations, the health service, welfare benefit agencies, blah, 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 blah. They are actors in constellation around that. And then the factors are things that kind of impact with and interact with those actors, and the pattern of results at any given time of that system is what we call the outcome of well-being or not. So a person's life has a complex system that produces an outcome. And this has implications then for human public service. So the human element provides the moral purpose of public service. We are here to promote human freedom and flourishing. And it says that human public service starts from the reality of the life of each person, because each person's life system is unique. And so to create an outcome in their lives requires understanding that unique context. And that means that human public service has to be built on strong relationships, because public service has to know enough about the detail of the life context of each and every person to be able to engage with them, and to produce an outcome in that person's, to help a person produce an outcome in their life requires bespoke by design service. Because if the context of each person's life is unique and how an outcome is made is unique, then public service response must be unique to that person. Human. So how does this stuff happen? If that's our kind of moral purpose, how do we make outcomes in each and every person's life? And what we found is that learning is the management strategy for public service. So this goes to the core question: how do we manage in order to help people create positive outcomes in their lives? And we find that creating an outcome is almost always a complex task. So it is complex because each person's life is different. It's complex because what counts as an outcome in each person's life is different. That the way that an outcome is made in each person's life is different. And all of these different things change all the time. So we know from Dave Snowden's Cynefin framework that this puts us firmly in the realm of complexity. And when we are in the realm of complexity, the appropriate strategic response is a learning response. And it describes a set of emergent practices. And what we've learned is that this learning strategy can be enacted by undertaking this kind of learning cycle with understanding system, co-design, experimental exploration, and embedding and influence. So let's say, for example, I'm a public service worker that supports someone who experiences chronic pain. And if you're a kind of health or social care worker, you'll know that chronic pain is pain that doesn't have an obvious correlating physical injury. So there's nothing to fix in terms of pain. So what I do is I seek to build a learning relationship with the person that I'm supporting, where we learn together about their life as system that produces the outcome of chronic pain. So at the moment, so I might ask questions like, do you experience the pain more in the evening or the daytime, at work or at home, or when you do this set of activities or that set of activities, when you eat this food or that food? And together we will build up a picture of that person's life as system that currently produces the outcome of pain. And then we can start to design experiments of ways to change that life as system to see if we can get it to produce a different outcome. So what happens if you have this diet rather than that diet? What happens if you try a different set of activities? Might you join this working group? Let's try this kind of physiotherapy manipulation and see if that makes a difference. Do you require different equipment in your house to enable you to move differently? And each of these experiments and explorations produces learning that can be embedded in that person's life as system. So we can change the actions and behaviors of that person and change the structural drivers around that person's life as system. And when we do that, we change that person's life as system. So we then need to go around the process again to understand the process. And so it creates a continuous learning cycle that is the public service in that person's life. And this is how we create bespoke public service, by each public service worker running this learning cycle with each person. So human learning systems. Quick systems 101. So a system is just a way of describing a set of relationships in the world that combine to make something happen. So when we talk about systems in human learning systems, what we're talking about is the set of relationships which create a desired outcome or its absence. So we've seen people imagine systems at 4 different levels that we think might be relevant. So I've talked through the idea of a person's life as a system. We've also seen people exploring organizations as systems, places as systems, and countries or regions as systems. And at each of these system scales, what people are doing is undertaking this learning cycle with a different set of actors involved in understanding the system, a different set of experiments that people co-design and then run together and then embed and influence the learning from that. So it is the same learning cycle strategy, but happening at different system scales. So let's dig into that idea a little bit more, because what we find is that what people end up doing is creating connected learning cycles across pairs of system scales. So this is the learning cycle that an organization as system might do in relationship with the smaller scale life as system. And what we've found is that each of these pairs of system scales essentially contain 2 types of questions. How do we learn from the learning cycle at the scale below? And how do we enable the learning cycle at the scale below? And so the organization as system, in respect of the person's life as system, so that dyadic relationship, might ask the following kind of learning from questions. It might ask, what patterns do we see from across all the person's life as system that we're involved with as an organization? So what policies do we need to change to enable change in outcomes for people? So for example, if we're a housing association, do we need to change our housing allocation policies to, in respect of anything we've seen from all of these, the work that's going on with people with chronic pain?
2 minutes, Toby.
So then there's enabling questions. like, what are the maximum caseloads for workers? What information systems do we need? What shared reflective practice spaces? What staff capabilities? How do we enable it? And what's going on is then a set of questions that at the larger scale that experiment with this. And so what we've seen overall is that the strategy is to create connected learning cycles at as many scales as possible. So from the person's life system right up through to the country and place system. And we call the process of managing governing learning cycles and the relationships between them system stewardship. So it is the job of system stewards to create these healthy systems to enable these learning cycles to function effectively. So you can see the characteristics there of healthy systems that, that system stewards are trying to create. A couple I would emphasize there, that healthy systems are diverse systems. So they hear the voices of all the people involved, even those that they have traditionally found hard to hear, and they address inequalities of power to enable that to happen effectively. So that was a ridiculously quick dash through. Summary. A human learning systems approach is a whole different approach to public management that starts with the reality of how outcomes are made. That's why we call it public service for the real world. And if you want to do this, learning is the management strategy. So if you have any management responsibility, your primary task is to create learning environments. And you can apply this at all of those system scales we talked about. And this works hard. It is, as you'll hear from the different case studies, it's significantly difficult to make these changes. It requires a lot of graft. But the payoff for this is better outcomes for less money that we've seen from a number of the case studies. And we get that because we've got happier people, both happier staff and happier residents. And final thing I'll say is that making this kind of paradigm shift can feel daunting. But I want to say is you can do it, because we know that you can do it because our case studies have done it. Now, our case studies are lovely, amazing people, but they're not superheroes, apart from Ollie Pecker, who can shoot lasers out of his eyes, but he doesn't really talk about that. If you want to do this tomorrow, you can start with 3 simple questions. So if you're a person who services works with the public directly, you can start by saying, how will I support, how will I learn with those I support? If you've got leadership roles, you can ask the question, how will I signal that learning is the strategy for all? And at whatever system scale you're operating at, what experiments will you create to explore learning as strategy? Thanks very much indeed. Hopefully that was provided some kind of framework. You're now going to hear from case studies at 3 of those different system scales. And you can find more information at humanlearning.systems, including all the case studies that we've talked about. Thanks very much indeed, folks.
Thank you so much, Toby, and really well timed as well. You know, after all these years of my serving in the public service and worrying where I was a total misfit because I could not really appreciate the structures in which I was working, I never thought that something might be wrong with the public service, always that something might have been wrong with me. But thank you very much for investigating this with all your colleagues and revealing to us an alternative approach to the new public management structures. We are now going to turn to the case study presenters, and the order in which we will do this will be first Sam Kammerling, who is from Likewise. I'll introduce him in a minute. This will be followed by Katie Owen, commissioning lead at the Liverpool Combined Authority, and Olli-Pekka Heinonen from the Finnish National Agency of Education, in that order. So first, Sam, just a few words from his CV. He says that he's been excited about all things learning since he realized how much fun it was some years after I shook off the shackles of formal education. Since then, I've been youth working, lecturing, and evaluating my way around trying to make sense of what really, truly supports all kinds of people to feel safe to be themselves, connect to each other, and expand their worlds. At Likewise, a mental health and social care charity, we are working with local partners to build a connected, flexible, person-centered mental health system. I've entered the world of learning for systems change, and it's been a fascinating, occasionally infuriating, and richly expensive, sorry, it might have been expensive as well, Sam, but richly expansive journey so far. So it's my pleasure now to have Sam Kammerling. Sam, over to you.
Thank you so much. Yeah, expensive. Thankfully, I'm not the person to ask about that. But yeah, thank you for having me. Really great to, I love listening to Toby chat because it all just, I'm sure lots of people feel the same. It resonates so much with the work we've been doing. So thank you for that, Toby, as well. So I'm from, likewise, we're a social care charity, and we work predominantly with people with serious mental illness, one-to-one support, emotional and practical support. I've got 7 minutes, which is tight, so I'm actually going to time myself because otherwise I will just waffle on. So I'm going to try and demonstrate, first of all, how we embed learning in the work that we do on a one-to-one level, and how we've learned that approach maps on and scales on quite beautifully to a kind of slightly more systemic, strategic approach as well. So hopefully that'll come through what I say today. So we came out of the 1980s in King's Cross in London, and that was a shady area to say the least. We started operating out of a church actually, but however what we learned when basically the church got taken over by the people we were supporting was that we actually had a tremendous amount to learn from people who understood their realities far better than we ever could. And through that, we developed a very particular approach to one-to-one working that is very much about co-production and being person-centered. We've got an environment that's so kind of like working with Likewise is so learning focused that it's almost exhausting. We all love working there, but sometimes you don't want to reflect on your feelings, but you kind of have to. And that's I think that's part of why we're good at what we do. When we came across human learning systems, it really resonated. And it also encouraged us to think more about the ecosystem that we worked with, not just the individuals we were supporting, and that was really exciting. I've also got our 3 main values there: learning, doing, and belonging. I won't go into detail, but I think that gives you a little bit of a taste of kind of our approach. So in terms of our learning approach, as I said, we work with individuals living with serious mental illness, schizophrenia, psychosis, depression, bipolar, the usual list. And we found that the learning approach has been absolutely fundamental to developing relationships that are meaningful and deliver outcomes in complexity. So for us, learning is very much a mindset. What we find is that if you go in learning instead of knowing, you're much more open to the rich realities and surprises and actually the full humanity of each person. A lot of people we work with have been defined by their labels, and they find that deeply frustrating, and they find that limiting. When you come in with a learning mentality and think, oh, actually, what's there? We talk about going underneath the iceberg. There's this little bit that's above the surface that people present with, and just through that learning mentality, that relationship building, you see all of that rich complexity underneath, and realize that whilst initially you might have engaged with support to get X, actually Y is way more interesting, meaningful for this person, and that only happens through that learning approach. Importantly, you avoid those assumptions. As humans, we're really, really lazy, and we love categories, we love labels, because then we don't have to think about it. And we are constantly vigilant, likewise, against those labels, which, as I said, completely exhausting and a real pain in the bum when you think you know something and your colleague is accusing you of knowing. But actually, it's incredibly valuable for bringing in that much more open approach, which means you can jump on opportunity when it's there, because often it comes up in really unexpected places. And it means that you see outcomes as being more complex. So rather than supporting something into one thing individually, you're working with someone more long term to understand them and support them to take advantage of any opportunity that comes along. Now, that learning approach also does something beautiful, which is it shares power. When you come in as a learner, you're asking someone to bring something to the table. You're not imposing your worldview. Instead, you're open to them as a person, and that creates a much healthier dynamic. Now, what's really important about that is it's not passive. We don't sit there and just listen to anything everybody says and agree with them. In fact, what it allows you to do is to share perspectives. So often we have people kind of who might complain about, let's say, their social worker, right? They say their social worker has been a complete effing blinding, words I can't repeat. And you can say, yeah, that's interesting perspective, but actually previously you've told us this, or previously we've seen this. And because we've got that relationship with them that shares power, that's not felt as a top-down position, it's felt as a dialogue. And that's how change happens. That's how you support people to see the world in its full complexity. Because of course, it's not just about seeing them, people in complexity, it's about supporting people to see their worlds in complexity as well. We have a lot of structures to support that. We have lots of learning spaces, reflection, supervision, and they're really important because it does stop that laziness from setting in and taking over. Now, we have long been a little bit suspicious, actually, of the kind of more systemic stuff that's happened around us, the local NHS, the local council. We kind of saw them through that new public management lens. And then COVID-19 happened. I don't know if you've heard of COVID-19, it's been in the news a little bit. And all of a sudden we were thrust, I haven't got time to go into details, but basically we were forced to work with them really, really closely. And it was actually really brilliant. And it was really brilliant because, first of all, the commissioners who approached us wanted to learn from us and they recognised what we did. And secondly, we kind of we offered to take on a learning role in that. And what we learned and what we felt encouraged to do, in part by knowing that this human learning system stuff was taking place in the background, was apply exactly the same stuff that we did with our clients to the more systemic working as well. And surprise, surprise, this slide is exactly the same, even though it's called learning in the system, it's exactly the same as working with the clients because all the same stuff applies, right? I mean, the easiest one to talk about is we saw the system as this big bad monolith. But of course, when we actually got to know it, when we built relationships with people in it, when we opened ourselves up, we recognized loads of lovely people who we previously saw as quite annoying, outcomes-driven KPI folk, as beautiful humans with various different incentives and pressures, and we built really rich relationships with them. We avoided those, we recognized that we'd had these assumptions and we moved away from them in a way that was wonderful because they were open to learning, they shared their power with us, we could bring in more of what we did and they could challenge us and we could challenge them, all in this context that was, because it was held by learning, was really, really productive. So again, long story short, the service that we developed with our kind of colleagues in the area won awards and all that jazz, blowing our own trumpet a little bit, yes. But we're really pleased with what we produced because of that kind of culture of learning. What's been harder is the supporting structures because learning is incredibly time consuming and learning it doesn't feel like doing, even though it's really important for the doing. It's hard to say, oh, can we have a reflection? Because people are like, reflection? I want to go home. I've got a million things to do. I've got outcomes to achieve. That is a trickier thing in a system that isn't necessarily used to it. However, what we are seeing is lots of individuals who recognize the value of this approach, who are increasingly enthusiastic about it. And hopefully, well, certainly we're really flipping hopeful that moving forwards as more people take on this approach, the stuff that we do with clients, not only can that happen in more different spaces, but as that's applied upwards as well into that strategic space, that is a really great opportunity for real systemic change and not this constant wall bashing that I think Toby's named already, that I think a lot of people have been going through. And that is my buzzer for 7 minutes, which means I nailed the timing. Thanks very much.
Wonderful, Sam, wonderful indeed. Thank you so much. Great insights, and in 7 minutes, it's amazing that you could share so much of that reality with us. Thanks again. Let me briefly introduce Katie Owen, who will be our next case study presenter. Katie has worked as the commissioning and contract lead for LRCA, which is the Liverpool Combined Authority, for 2 years, where she has commissioned an assertive outreach service using human learning systems as the approach. Being part of a team that has developed a housing first service across the Liverpool city region. Prior to this, she was a commissioning manager for supporting people and managed the housing options team. Implementing the Homeless Reduction Act, Katie has worked in homelessness for over 25 years in both statutory and non-statutory services and has managed hostels and various frontline delivery services. Katie, great pleasure to have you. Over to you.
Thanks very much, and it's really exciting to be here. So thanks very much, Chris. If we go to the next slide. What we commissioned across the Liverpool City region was an outreach service that covers the 6 local authorities, and it was an integrated service between support workers, a physical nurse and mental health staff. Also, that was a partnership between the Whitechapel Centre, Brownlow Health and the Mersey Care. Thanks. How we approached our commissioning, thanks Chris, was we decided to take a learning approach. And I think, you know, as Sam has alluded to, and Toby, and I'm sure you'll all understand this, it's quite easy to develop a specification and say you want A, B, and C, but what we wanted to understand was to recognise the complexities of the environments that the service would be working in and the wider needs of the communities. We didn't want to develop a service that would say A, B, C, D will be achieved without recognising that will never work when you're working across various systems and complex other services. So we worked across the Liverpool City region with all the local authorities and our lived experience group to develop the specification. And key to it was the provider had to take a learning approach to their delivery. Outcomes, it wasn't driven by that. We wanted to see it as an opportunity to test and learn. So we know that services are held to account for hitting targets in an environment that they don't control. And as Toby says, you know, I've been a commissioner, I've been a provider. It enables a manipulation of data which produces misleading information that we keep commissioning on, which is really then becomes a vicious circle. So hence, as a commissioner, we wanted to do something differently. So what we looked at was a human learning of systems and understanding that the way to do that was key for us as a commissioner was to build relationships and trust with the services that we commission, was to be able to establish shared purpose of what we wanted, but also allow us to be led by the provider who actually delivers the service, and also to help them make the system visible so we all understand what system we're operating in and how that impacts on any sense of delivery. So we embedded a learning systems approach, and we did that by recognising within the contract and within the contract monitoring the outcomes, and that they understand that they're produced by whole systems rather than individuals, organisations or projects. And our priority was to develop a healthy system in which people could be honest and collaborate more effectively. So alluding to Sam, the learning bit has been hard because we regularly meet with our provider. And, you know, in traditional commissioning relationships, that's not always seen as a positive, but we regularly meet to discuss what's working, what isn't, what do we, as a commissioner, do we have to adapt and respond? How do we make sure this has been working well? We also don't just meet with the managers of the service, but the staff on the ground to talk to them, and our contract monitoring officer, who is like our system steward, goes out with them on a regular basis to understand what they're actually delivering and how they're working. We also then wanted to look at how we would embed that by understanding the system and players to enable that relationships based on trust and clarifying a shared purpose, but also recognizing that we will change the principles and values and behaviors we want to stay the same, but the dynamics and specification of the service may change. If something's not working, why do we keep going on a 3-year cycle? If we've learned in the past few months that this doesn't work, we need to adapt. And again, we wanted to put learning at the heart of the governance and embed and influence services across the wider scale of homelessness, health, mental health, to understand that we will never get anywhere if we use an approach of an outcome data system. So our system steward, who is our contract monitoring officer, she developed very close relationships from day one, has regular meetings to ensure the service is flexible and tailored. So as the service is across 6 local authorities, the provider has to present and deliver differently in each local authority. That is difficult for a provider as well. Their staff have to adapt to the needs of the homeless people rather than to the needs of what the specification says. So if we get feedback that this isn't working, we will adapt and change. If it's not meeting the needs of the individual, why are we carrying on? And again, we worked with our partners closely to identify blockages. So we regularly meet with the local authority leads and the providers, and we enable that communication back and forth. And again, it's a continuous evaluation to ensure the service delivers what is required. It also enables a change in how you deliver or how you commission by learning, and that will help our future ways of how we commission. We also look at doing our contracts. System steward worker also does regularly learning approaches with the staff teams. So from that, we've been able to change some of the things that we thought were working, and they've fed back and said, look, this isn't working in one area, but does in another. Can we adapt and change? So that has enabled that continuous change rather than remaining the same service. Our change of approach was to support and develop, and I can just trust is paramount, especially for people who commission services out there or are provider of services. You need to ensure that your provider and the people you're working with trust you and trust that you are working with them, you're on the journey with them. It's learning for all of us. Also, we needed to look at, acknowledge the variety of strengths and needs, but look at it from different perspectives. How does the service users who are receiving the service feel about the service? How are they embedding our learning? How are they enabling us to change? We also know that outcomes are produced by many factors interacting in an ever-changing way. So it's really difficult to commission a homeless service, including mental health staff, when we know the thresholds to get into statutory services are getting higher and higher. And it's about acknowledging, how do we find different routes to navigate? How do we support the providers to enable them to secure access to those services? Rather than the data being seen as a negative, how do we then enhance our access to those services? And also, a lot of our providers and staff are working in systems that are beyond their control. And it's also helped this approach. Our providers have found they're understanding the system they're working in better as well. I think it's a bit like Sam saying, that learning journey of when you're working with the other services through COVID, you see the other side. And I think that is really important, and it's our role as commissioners to enable that and help that. And again, we enable, or we ensure that delivery is built on our learning. So hence the regular meetings, regular communications, all being all together to make sure that we're learning from that, but we're flexible and responsive. Please, we can't commission services for 3 years and say we don't expect change or etc. Thank you. And our learning, as it's been, it takes time to develop trusting relationships. A change in a culture and commissioning in a way is wide-reaching, and a system within itself. Commissioning, as I'm sure you'll all be aware, has its own system, and that learning from that. But also, as commissioners, I feel it's our duty to enable our providers to trust their instinct and knowledge. They know what they're doing. They're the experts in delivering services, and we need to give them every opportunity to enact on that instinct and knowledge and skills. I hope I'm within time.
Yeah.
Okay, thank
Wonderful.
you.
Thank you so much, Katie. And again, to cram so much experience and insights into the 7 minutes you had is really amazing and very helpful for us. And I'm sure our participants are having the feast I promised them. We will now turn to Mr. Olli-Pekka Heinonen. Olli-Pekka is formerly of the Finnish National Agency for Education. He became the 8th Director General of the International Baccalaureate Organization in May this year. Prior to joining the IB, Mr. Heinonen was Director General of the Finnish National Agency of Education, where he worked from January 2017. Olli has had an active career in politics in Finland, between 1994 and 2002. During that period, he was Minister of Education and Science from 1994 to 1999, Minister of Transport and Communication from 1999 to 2002, and a Member of Parliament from 1995 to 2002. So now we have a senior policymaker as well with us. So wonderful to have you, Ollie, and over to you.
Thank you very much. Really, it's a pleasure to have this chance to share with you our experience from Finland, from the National Agency of Education and the creation of the Innovation Center that we have had in the agency for the last 4 years. I want to share with you a bit of the background why that type of an innovation center was created. Then what has that innovation center done? And at the end, kind of some key observations of the work that it has been doing. First, the background. In Finland, the Ministry of Education takes care of the legislation, financing, and the kind of national strategy. Our agency's responsibility is to develop education from early childhood education up to adult education. And it was a well-functioning system that we had in place in Finland. But then we noticed that there was a kind of a situation that although we had kind of, I would say, greatly written national strategies, that they did not get implemented. And we know in Finland that we have kind of excellent teachers and excellent kind of principles on the local level. But there was clearly an implementation gap that created huge amounts of frustration on the learner level, on the school level, on the local level, and on the national level. And it kind of became clear to us that the kind of needs of learners, different learners, they were more diversified than they used to be. And for that reason, the old kind of way of managing things on a national level, it didn't work anymore. So we had to find a new way. And we actually were not sure that what would it be. So there was a decision done that let's experiment. Let's create an innovation center and see that could we create a different way of implementing the development of teaching and learning and schooling in Finland. And that was done. And that innovation center that was created, it started, of course, because it's an experiment on itself. It started with experimentation labs, 3 types of labs. First ones were to co-create local solutions together with the local actors to co-identified challenges. The second experimentation lab was about aligning the national policy with the local development strategies. And the third experimentation lab was to help the educational experts on the national level to transform their way of governance thinking and their mental maps that how change is possible to happen with public services. What was done? In practice, I think we've been hearing 2 excellent examples, and there's so much kind of similar approaches that we have heard. The big thing has been to create a trustful environment to learn together, to bring the different actors together and identify that do we have a same view, what are our challenges, and then together to start to learn to find the solutions. In the national agencies case, what is kind of very challenging is that there are many different scales of systems. There's the learner learning loop, there's the school system, there is the municipality system, there's the growing community system, and then there's the national system. And they should all align and learn together. So it's a kind of a fractal. And that means that it's not only kind of possible to have a kind of the view of the kind of second person perspective, but you have to be able to understand also the third person perspective and actually the fourth person perspective in order to understand the system. And what is also essential is that you understand that you're not outside that system. You are not a kind of a machine manager above who has created the system and kind of manages it. But everything you do has an effect on the system, and the system has an effect on you. One other kind of key observation that I would like to share with you is the kind of moral basis of the system stewards, meaning that they do not see the other actors as kind of players in a game or roles, but see them as human beings. And that it's not kind of playing a game, which is not reality, but it is the real life. And that means that you're meeting the other persons as human beings. And that is a very kind of different approach than the kind of traditional public service approach has been. And then the last thing that I would like to share is that we often think in public service that we kind of think first, and through thinking, then we change our action. But in this, it should be the other way around. You act, and through acting, you change your thinking. Because through action happens the cognitive dissonance that makes it possible for us to learn new things. And that means that we are moving from kind of performance management, we are moving to capacity building. And the great thing in it is that it enables that you can be part of a collective learning path. Thank you.
Sorry about that. I just had a mute on. Thank you so much, Ollie. That has Ollie-Pekka, that has been phenomenal. I am looking forward to engaging with you, and over time, it will be amazing to see, or very interesting to see, how many political leaders in today's world will be able to share your thoughts. And I'm sure the HLS group will want to have you engaged, to be able to persuade some of our senior policy people and political leaders to begin this journey and to start to think like this. Thanks to all of our presenters so far, Toby, Sam, Katie, and Ollie-Pekka. We will now form a panel with these 4 speakers. And what I will do is I will pose a question, and then I will ask all the panelists to quickly respond, maybe in a minute or two, up to 2 minutes, and then see how much time we have to pose some other questions. I want to start with the first question, which I'm posing to all of our panelists, all 4 of you. All of you mentioned that human learning systems might be a cheaper way to produce even better outcomes. Can you share with us what's the evidence for that? And why is it the case that this is happening? So maybe we can start with Toby and then with the other panelists.
Yeah, very happy to answer that, Naresh, thank you. So firstly, it's impossible to know for certain around this, because that kind of cost research costs multiple millions. And then even when you do it, the best answer it can produce is, well, this was probably the case in this context. But the strong indicators we get from the case studies seem to show that there are substantial savings that happen as a result of the human learning systems approach. So, for example, the Plymouth case study shows a 50% reduction in their emergency accommodation budget, which was a huge budget for the local authority every year. They found a massive reduction in the use of emergency services by those who had been most significant users. Look at the wellbeing teams case study. You see an 80% reduction in unplanned care for wellbeing teams clients. 80% reduction. We see sickness rates for wellbeing team staff at 1/3 of the national average for, and the staff turnover rates at 20% of the national average. 20%. That gives us a sense of the possible savings here, but the final thing I'd say around this is that the most important aspect of this is that these savings are being created because the service that is being offered is human. So that's the crucial thing. It's the purpose. You only get those savings by doing the right thing. If you go at this with a purpose of cost cutting, you'll fail, because the first expensive micro decision you'll come to go, oh, that's a bit much, that's not it. If you stick with the purpose, then you'll get the savings. So Gary Wallace, one of the key people in Plymouth around this, says, his line is, if you stare too hard at the savings, you'll make the wrong decisions and you won't get the savings that you want. And backed up by lots of evidence from the Vanguard method folk who say, if you try and manage to cut costs, all you'll do is increase costs.
Sam, you want to comment on this?
No. So I guess the thing that pops in my mind, the evaluation we've recently done of our project alongside commissioners in the US pointed to a 85% reduction in contact with crisis teams, in hospitalisation, and I think a 75% reduction in contact with crisis teams. So yeah, it's exactly as Toby said. It suggests that it's really working, but it's so hard to build that case, and so time consuming. We couldn't do an RCT. We're a tiny group of folk, and so that evidence is hard. I guess, also my initial thought was, well, actually it can be quite resource intensive initially. So looking through that lens, it can look at that initial splurge of resource and time spent on learning can be a bit frightening for people who are constantly looking at the budget. But I think Toby answered it really well in saying that actually looking at it that way is possibly the wrong way to look at it.
Mm-hmm. And you're right. In order to answer that question definitively, I guess we would need to do some RCTs, which we might want to think of down the road. Those are expensive in themselves to get done, but one of the only sure ways of making an intervention outcome kind of link. Katie, any reaction to that question?
I think it's maybe not looking at the costs, it's the savings and the future of development of services and what they will bring. And the human individual cost, I think, is very hard to monetize. But when somebody receives a service that's developed around their needs and understands what they require, I think the savings in the longer run will just be, unbelievable. But it's also, I think, that intensity of the beginning, the front loading, you will end up commissioning services if you follow this approach that actually work. And that the idea of the cost savings there must be enormous. But if you're actually getting services that actually work and link in and understand, follow, are part of the system, I dread to think how much I should imagine it'd be massive.
Mm. Yeah, I noticed in the chat messages, and people are chatting away on this topic, that people have mentioned that RCTs might not be the best or most appropriate tool for this, and that might be quite true, because if we are working in a systems approach, RCT is highly reductionist and will not be able to capture all of the issues. I take that point quite well. Ollie, what's your reaction to that question I posed?
Well, some perspective. Maybe first the fact that in a kind of a traditional way, the new public management way, which kind of often creates also organizational silos, there is the tendency to create also a lot of kind of failure demand, which actually becomes very, very expensive. That you're kind of circling the same people in the system without helping them at all. Another point is that, like for example, in Finland, we have been doing our kind of social and health system reform for 12 years, and it's not ready yet. And this is a kind of an answer, because sometimes it's a fact that the learning takes time. You have to reserve time for the reflections and the learning to happen. But if you compare it with those 12 years of those reforms, I would say that it might have been a faster approach of getting those reforms implemented.
Let's move on to another question. I want to draw a bit from my own experience in the public service. And I suspect, now I'm talking about the government service part of public service. And whether it be in the federal public service in Canada, or whether it be in the public service in India, and I suspect in many other countries, maybe not in Finland, but we can hear from Olli-Pekka. When people are in control, they feel a sense of power and authority, which they are not, in a hurry to give up. So change from the existing paradigm to the one we are talking about, while highly desirable, might be extremely difficult. And I wonder how you see this happening. This time, why don't we start in the reverse order and start with Olli-Pekka?
Yes, thank you. It's a very, very, very interesting question. I think that is true, that we do have still kind of a model of political leadership as being kind of heroic leaders who kind of scan the problem and kind of solve it, and then kind of save the world and ride to the sunset. And what we see that type of leadership is creating is more and more problems. My experience is that as a kind of a state secretary in the Prime Minister's office, for example, that the ministers, they do understand that there's a change happening, and that there is a need for a different approach. And the question is that whether there is kind of courage enough to take the step of saying sometimes that we don't have the right answers. We have to experiment. We have to solve these things together with the actors and the owners of those challenges. And of course, I would say that in Finland, that type of thinking is spreading. It's not kind of something that happens in one moment. It's not a big bang, but it's something that kind of gradually grows from inside the system.
Wonder if some others would like to jump in. Let's check in with Katie. Do you want to react to that?
Well, I think on the power dynamics within the commissioning, I think for some people that's quite frightening around letting them go. I think we've been very fortunate in the sense we've had support from the Ministry of Housing, and I'm pleased one of the gentlemen was on the call today, and they're quite interested in how you approach things differently. But I think it is really refreshing to hand your power over to the people who are delivering and working in the system and helping them to understand the system within that commissioning dynamic. But more interesting is handing that power to the people who use the service, which we've really tried to work hard to with our service user involvement, lived experience involvement in the specification, in the reviews, in the learning. So I think, and that actually is helping us help MHCLG, the Ministry of Housing and Communities, understand. I suppose I see our role as trying to help them understand why we've got to change. You know, and things like this event, and Toby and the e-learning book. Toby's been very good at doing presentations for us, but it's things like internal procurement. There's so many elements and factors to it, but trying to help them address that. I think power, you have to accept, is an entity we don't need. It's about learning together and developing. I don't know if that gives them.
Sam, what are your thoughts on this shift?
I think it's really, really complex. I think, yeah, that hero mentality that exists not just at the level of kind of commissioning and the political level, but, you know, a lot of my work is when I supervise support workers, people get into this kind of industry because they want to be the helper, they want to be the hero, and it takes a lot of work to kind of filter that out. It doesn't really disappear, right? Like, even my ego was inflated by being invited to this, right? We all want to be part of something and to be taken forwards. And there's a value to that as well, right? That hero mentality can actually be utilized to some pretty positive impact in certain spaces. So it's a really contradictory idea, but I think it's very it's deeply emotional. It's about how we feel about in these spaces, about how we feel about giving up power and holding power. And I think owning that emotional aspect of in all of these different spaces and bringing that to the surface might be a way to start.
So professors always have the answers. So let's ask Toby.
I think that might be part of the problem. What we've seen from across the kind of the different examples of change is that the energy for change starts with dissonance. So in virtually all, like every context that we've seen, we find people who are fed up with the status quo because they know it doesn't work really. And so just about every case study example I can think of has been started with a process of people in their context sounding out and finding out who else is feeling the dissonance that they're feeling. And once you gather together a small group of people who are really fed up with how stuff is doing, then those set of people can start to experiment with doing things differently. And what we found is that the smallest scale experiments, like someone going, I'm just going to change my practice and see what happens. I'm going to adopt learning as a strategy and see what happens. That then creates the potential for other things. So in some respects, I wouldn't worry too much about like making massive change and there are blockers, and there are always blockers in the way, and change is always difficult. But what we've seen is that everyone can do this at some scale, and the more that those kind of everyone ripples start to ripple together, metaphor's broken down, then that's how we get big change, right?
Yeah, I've observed, in the Federal Public Service of Canada, we always have a change management process. By the time one is finished, another one starts, but they are largely rearranging the decks on the Titanic, the chairs on the deck. And you're still in the same NPM structure. So we would have to conceptualize some fundamental shifts. For example, how do we make power a positive sum game? So people don't always have to see themselves as losing for others to gain, and shifts of that kind. So it'll take a bit of work, but with the amount of frustration coming through from the existing system, we hope that some energy will drive us to go there. So let's get a few practical comments before we wrap up this panel. I'd like to ask in terms of people making change from tomorrow. What steps might people, listening to us, engaging with us? And by the way, I should mention that we have an extremely productive chat going on. From the little I've been able to observe, it's really both a lot of information there and ideas and references and so on. And the exchange is phenomenal. So I'm sure we will find a way of not only having the recording, but maybe copying the chat and making it available to all. That would be wonderful. I'm sure all will be happy with that. But the next question is really, for those of us who want to begin to engage in some change from tomorrow, what action steps might you suggest that people can take as some practical shifts beginning tomorrow? Maybe we should start with Katie this time.
I think if you're already in a cycle of commission services, you could adopt a learning approach quite quickly in your reviewing. That could be a very quick step. So when you're going out to review yourselves, you can adopt that, and we can share here a learning document that we use as the monitoring. So that again addresses what have we learned, what are we going to do differently, what feedback for us as commissioners, how is the system working, what support do you need. I think that can be done very quickly. And then I think I would strongly suggest you look at the previous 2 reports that have been developed with Toby and Collaborate, and take them as a guide to help you start thinking about how you commission to learn rather than for outcomes, and get on board your internal colleagues as well. But I would suggest quickly take that learning approach with your current services.
Sam?
I guess from a kind of service delivery lens, I think probably the thing for us would be that helped us the most was apply the principles, to commissioners, managers that we apply to our clients, to humanize the entire process, try and understand their pressures, incentives, the ecosystem they work in order to find that humanity. And also, if possible, and as things open up, take them out for a beer, do the thing that brings the humanity into the process to make the whole thing more human and therefore inevitably more productive.
Mm-hmm. Olli-Pekka?
Well, I think the first question is that kind of whose problem are you solving? Understanding that, and then the next step is in my experience, the most difficult one, which is the one that we are kind of professionals in some area, and that kind of expertise that you have, it creates a spotlight and a perspective to those challenges. But there is so much in the shadows that you don't see because of the spotlight. And you have to be able to turn off your kind of professional spotlight for a while, and to kind of engage in the kind of area of kind of not knowing, and kind of enter the land of kind of unknown. And that's scary. And that kind of is the big identity step that needs to be taken in order for the learning to happen. After that, I think a lot of things kind of start to happen as by themselves.
Finally, last quick comment from you, Toby, before we move to the Q&A session, where we will take questions from the audience.
I felt like I dealt with this on my final slide, so you don't need to hear me repeat that again.
Okay. All right. Very good. So now we will turn to the Q&A, and this is where we take questions from the audience. And we have several questions targeted to the individual panel members. So Toby, we'll start with you, since you were graceful enough to pass on the last question on the panel. And here are a few things which I will sort of combine into one main question. So you might take any notes you wish as I just share this with you. So the questions combined says, building on how you ended on the importance of hearing all voices, what tools have you seen for hearing, making space, working with people who don't understand or want to work in this way? In other words, what new skills, expertise, and experience are needed by public service professionals to work in this new way? And to take how would you take an individual through this learning cycle and design the experiments? So those are some for you, Toby. Why don't you react to those before I move to Sam?
Cool, yes. So like some of the best work I've seen around enabling all voices to be heard and kind of tackling some of the structural inequalities that underpin that is a bunch of work that the Lang Kelly Chase Foundation has sponsored. So they have supported work including kind of like deep democracy that enables people with different perspectives to hear one another's voices in the system. They have supported processes whereby people with a lived experience of the problems that a service addresses and decision makers get paired up and do kind of co-mentoring of each other. There's a range of really kind of fabulous stuff that they've been exploring and experimenting with, and I would kind of really encourage people to check out the material that they've produced around that. As a method in general, appreciative inquiry seems to be a really useful way of enabling people to hear each other's stories and hear and recognize everyone in a system as a human being. So the way that Plymouth Council, for example, has used appreciative inquiry to enable people to hear the voices of the kind of most marginalized people that they serve, and also to enable service providers to see commissioners as human beings in the way that Sam does, and commissioners to see other, but like doing appreciative inquiry with everyone in the system seems to be a systematic way to build empathy between people. The other really interesting kind of piece of practice that I would highlight is a piece that Paula and colleagues in the Innovation Centre were talking about, where they used mentoring practices to help public servants to shed the expert identity that they'd previously come with, because when you kind of dig into this, a lot of the identities that enable kind of particularly senior people in public service to feel successful and to feel like they're doing a good job are expert identities. People look to them and go, you're supposed to know the answer to that. And that's a really hard position to then be curious from if you're expected to know the answer. So the mentoring work that Paula and colleagues did at the Innovation Centre to help those public servants unpick their expert identities and engage in that kind of local systemic exploration with curiosity is another thing that I would point people towards.
Mm-hmm. Thanks very much. If there is time, we might explore some of these a little bit more, but your comment about experts reminds me of when I was in the United Nations system as a senior colleague official. On entering the system, my first observation was that everybody in the UN is an expert. And when you're an expert, by definition, you don't learn. And, it was intriguing to see how would we make the United Nations Development Program into a learning organization if all these experts feel they know the answers to everything. And yet we were talking of participatory processes and all kinds of other things and bottom-up processes. And we were busy having this mental mindset that we were experts and therefore knew everything. Huge challenge. But let me take the opportunity as well, which I haven't done yet, to welcome Paula Tirvainen. I hope I got that almost right, Paula. Paula is taking the place of Oli Pekka, who had to go to another meeting. So Paula has kindly agreed to join us, and I will pose the questions that were raised for Oli to Paula. Paula is Senior Innovation Advisor in the Finnish National Agency for Education. Welcome, Paula, and we will turn to you in a little while after when we come to the questions posed to Oli. Now for Sam. Sam, the questions to you combined are the closed systems are defensive, resist information flow, and connected relationships. So they resist both information flow and connected relationships, which resists and rejects learning. How do you create the conditions for control-loving leaders to loosen their grip and invite them into encouraging learning and information flow? Quite interesting. This is seems to be from a colleague here in Canada. What examples do you have of tools and techniques used in reflective learning processes? And finally, a reflection on everyone I've worked with claims to be interested in learning. What do we know about what is most effective in making genuine collaborative learning a systemic reality? How do we know when we have learned something? So it's a bunch of related, connected questions. Hope you can give us some insight. Sam, over to you.
Wow, I feel woefully inadequate to answer massive questions. Cripes. All right, so the resistant systems one, I really resonate with that kind of initial cynicism there. So how do you create those openings? I mean, I think I always think about it in terms of almost like memetics. Like you need to find the bit where you match with that language or with that culture, and then from there kind of build relationships within. It's like that. I can't remember that game I used to play on the PC where you like turn the diamonds over and they all go. It's like Tetris, right? So once you found the block that fits, eventually kind of the line fits, and that's how I imagine it. The way that we found that has been exactly that. I mean, COVID broke a lot of barriers down for us as well on that process. So some fundamental structural things, competition disappeared, first of all. So we weren't competing for resources. That was huge. What was the other key one? Funding at that point during COVID, it wasn't such a resource panic. So that was huge as well. So these key structural elements. And from that, we built really positive relationships with a few people that have lent to this proliferation of those positive relationships. That proliferation brings together like-minded people. Those like-minded people are slowly forming a group of people who have the same, it's values-led as well. It's the same values. There's different ways of doing things in different parts of the system, but when you agree on that shared purpose and those shared values, it seemed to work better for us. However, that is one very limited experiences in one tiny corner of London. So I don't want to suggest that moves beyond. I mean, the other question about, that actual learning, you're absolutely right. I've been in lots of learning spaces where it's been like, is this learning or is this backpatting? Is this sharing that we're all on the same page about something? Learning is uncomfortable. And that's how you know you're learning, because you are squirming and you're sweating and you realize that you've done a bad thing. And if that's not happening, then you're probably preaching rather than learning. So I'd point to that. But again, I'm sure someone's got a more profound answer than me.
Quite a response to how you would know. Never thought about that. But maybe we can, others can reflect on that if we have time. But let me move to our other panelists. Katie, here are some for you. So it says, everyone I've worked with claims to be interested. This one is on learning as well. So if you want to take the opportunity to respond to the question about You know, learning, the obstacles to learning, and how do you know you're learning? But also, what tactics do you recommend for individuals who want to advocate for the use of a human learning systems approach? You know, in large organizations whose systems are deeply oriented towards certainty, predictability, and metrics, where to start? And then another one you will find interesting. How do commissioners avoid setting up providers in competition with each other? Those two small ones should be adequate for now, I guess, Katie. So over to you.
If I say commissioners avoid competition, I think we all have to acknowledge this is a journey and we're all on it learning. I think one way of avoiding competition may be when we actually get the reality of what's happening on the ground operationally to feed your commissioning plans. That might help you actually develop improved specifications of what is actually required. I think I've been a provider and a commissioner, so I know I've had to manipulate data sometimes to ensure I've got paid. So I understand that. And I think if you're actually giving an honest response and actually doing something, you will improve what you future commission, which then might take some of the competition out. And I say this, and I don't want to sound naive, because you might get less tendering because there'll be providers who know they couldn't meet that. Because when it becomes a game in data, and we do know, you know, that the more advanced computer systems you've got or whatever, you can collect data, and the more intelligent data officers you've got, whereas actually what we want from commissioning and commissioning to learn is we want intelligent people on the ground working with the people who are receiving the services. So I think that this approach hopefully can help move that forward in time, but I think that doesn't stop us from all trying a different way of working and looking at different ways of approaching it. But the system steward is also key, because that will help you understand the system and the blockages and the challenges and etc. So I hope that answers some of the question. I think, how do you approach people who are obsessed with metrics and data, etc.? I think we have to ask ourselves, and I can only do this within a homeless context, you know, if we look at the funding that goes into homelessness, we have to ask ourselves, how is it working? Despite very hard work from people on the ground, providers, we still have a dreadful housing shortage in this country. So by working in silo in one area of the system and not addressing other areas, it's never going to work. So I think it's about gradually helping people within your organization understand what the information they're being given and the reality of how that is on the ground and how that's impact. I think impact is a really important part to talk to help people change, maybe how they measure or what they look at. And I think key to it is this is human beings we're working with. Human beings do not work in a silo way or in a way that says they'll produce A, B, C, D. Things will change and differ. So you have to be able to develop systems or services that can be flexible and responsive. And I think if you could start those conversations, now I know this is being recorded, naivety has always been a great tool for me. When I've come up to my procurement teams and my data teams, naivety is a great way of approaching the conversation and, you know, working from there. I don't know, have I answered the questions?
I think so, yes. That's at least a good contribution, Katie. Thank you.
Yeah.
But let me turn to Paula. Paula, the questions to you and reflecting, of course, on the questions to Holly. The first one is, what leadership skill is lacking most within today's public service executives? How do we get regulators to see what they do as part of the system when lots of what they do is predicated on them being independent? And the follow-up question is, what are the major constraints to innovation in public service delivery?
thank you very much for just hello everyone. I'm Paula Tyrväinen. I've worked with Olli-Pekka for the past 4 years. Just a quick reflection on the first question about the leadership structures. I'd say we talked about the learning journey, and I'd say it's important for us to take the leaders onto that same journey. So the changing role of expertise actually is the same question, or tricky question for everyone. I will work on the education sector, so for teachers, municipality representatives, public servants, even for the politicians. So that's one strategy you might want to cope. And then the constraints for innovation. I'd said that the Finnish innovation system seems to be that we have one model and we want to implement it quite quickly. We want to go directly to the solution. So how might we cope with alternative future horizons and futures orientation and future consciousness in that sense? So I'd say that developing the ability to cope with uncertainty. Topi mentioned about the mentoring program that we have. We've experienced a number of ways to create a safe place where everyone can come together and make mistakes and still feel comfortable, so that the risk is very low. So you don't risk everything by making a mistake, and you can learn more easily. So creating a safe place where innovation can actually take place before you scale it. So don't go into scaling before you've actually done the journey. And one more comment about the expertise and the changing role of expertise. It seems to be that it's very difficult to see it as a journey. It's more of a kind of end stop. And that's what we're trying to kind of relearn what expertise is. And I think that links back nicely to the question about the leadership. That's all. Thank you very much.
Thanks very much, Paula, and thank you for joining us. So this brings us to the end of this part of the session. Let me invite our participants in concluding to put in the post in the chat, if you don't mind, the one word that comes to your mind when you reflect on what you have heard from this seminar. We'll appreciate seeing that one word. And in conclusion, let me just say that the transition to a more human public service is long overdue in my own view. We now have some practical insights on how to do it. We will need all hands on deck. Thank you, all of you, so much for joining us today. And remember, we're having a little after this Zoom party. And so let me turn it over now with great pleasure to Toby, who will set that up. Toby, over to you.
Thank you very much indeed. So just two things for me to wrap off. If you want to kind of continue with your human learning systems journey, if you want to explore it, then we tried to create a single page for you to click on and say, if we want more information, you can find it here. So you can find it at humanlearning.systems/join.community. So at the bottom of that page, and my colleague Amy will put that into the chat as well. So do download the book, check out the resources on the humanlearning.systems website, and if you want to get in touch to either to do more or to connect more, then you can use that particular form. And then finally,
we need to ask, Toby, we need to ask colleagues, to all our participants, to complete our survey online.
Yes. Amy will put links to that in the chat, and also because we appreciated that this webinar format hasn't given people the opportunity to interact with one another. So we were thinking, how would we do that? So we decided to create a separate Zoom thing with a more normal Zoom environment, where people can talk with one another about their questions and their experiences around this topic in small groups. So my colleague Amy will put the link to the Zoom after party in the chat. Has to be said, we thought that this might have like someone between 50 and 100 participants in it, so the numbers might overwhelm our capacity to have planned this effectively. But we'll see if you want to continue talking with this and connect with other people for a short period of time. We'll see you in the Zoom space that Amy's just put into the chat, and also remind my colleagues who are doing tech around this that there have been several requests to capture the chat and maybe circulate that afterwards. So before we shut this down, if we can do that as well, that would be amazing.
Thanks, Toby. One other point that I in fact forgot to mention. Thanks for helping me out with the call to action part of this. One of the things that we might do going forward, all participants who are interested, is sort of setting up a practical learning community on HLS, a kind of a community of practice, but not exactly that. It's more a practical learning community. And so we might send out an email or an invite to engage with you in this learning community. In other words, walking the talk, so to speak.
Brilliant. And Collaborate are organising the first one of those on the 28th of June, I think. So we will send you details about all of that very soon. Grand. So I'm going to go in now and nip over into the other Zoom link and start to welcome people into the after party. I hope to see some of you there very soon. Cheers, folks.
Thanks a lot. That brings us to the end of this formal session and over to the after party. Unfortunately, not much to drink over there, but a lot of food for thought.